I am Dr. Nadiesda Costa. I am a physician. I specialize in kidney transplantation at MedStar Georgetown Transplant Institute. I see patients with end-stage kidney disease looking for treatment options. The typical treatment options are dialysis or transplantation. Kidney transplantation has been the best choice for patients with end-stage kidney disease. I also see patients that are of Spanish descent that speak Spanish. For my patients, I treat them as a whole. I treat them like they're my family. In part, my work feels like an extension of my family. I have a bigger family here, and I want to treat the whole person. A long time ago, when I was in medical school, I did work with a nephrologist that inspired me in kidney transplantation. For a long time, I put that aside and went through my standard training. But in the end, I really wanted to help people with kidney disease. There are so many people with kidney disease in the world. And in the place that I'm from, a kidney transplant was a dream when I was training. It was nothing that you could see in reality. So getting to that point, when I'm seeing patients with end-stage kidney disease and struggling with dialysis, I wanted to do more. I wanted to give the patients as close to a normal life as possible, and transplantation does offer that. My job is as exciting, I think, every day. Every day is a challenge. We see a lot of diversity in people, in culture, in disease presentations. My colleagues also are wonderful. The environment is very nice. I do love coming to work and seeing what's ahead of my day, but also just having my partners, my colleagues, and all the staff just making it better. That's one of the most important parts. So in the last 5 years in transplantation, there's been a lot of excitement in looking at the future as far as making the kidneys last longer. We have a shortage of kidneys. We have a lot of patients that need kidney transplants. And so diagnostic testing, non-invasive diagnostic testing has advanced recently. That's one of the things I'm very interested in, to make sure that we can get ahead, we can predict early what's next with the transplant, what do we have to face, what are our challenges. So that's been the most exciting part and the most innovative in the last 5 years. Patients should come to MedStar Georgetown University Hospital because we have a great team. We look at the whole person. For kidney transplantation particularly, we offer a lot of services from before the transplant, in the early days, in the pre-transplant stage, helping them obtain a living donor, offering them services such as how to build a website. There's also donor benefits that we have. And we have access to state-of-the-art testing, to a high level of expertise across all the fields of medicine. I chose MedStar as my future in my career because I do believe in all of those things. I believe in treating the whole person. I believe in having collaborative teams to make it better for the patient. The most common cause of kidney disease in the United States is diabetes, followed by high blood pressure. Diabetes and high blood pressure are chronic conditions that are progressive, and in time, especially if they're not recognized or particularly well cared for, they can affect the kidneys. It is not clear exactly how diabetes and high blood pressure cause kidney disease, but it is thought that over time, just the constant process of the high blood sugar, high blood pressure affects the kidney tissues. The treatments for end-stage kidney disease are dialysis and kidney transplantation. Kidney transplantation by far is the best treatment. It improves the life of the patient, allows you to live longer and better. There are two main different types of kidney transplants, one from a living donor and one from a cadaveric donor. A living donor transplant, it's better, it lasts longer, the patients do better, the patients live longer. So we recommend living donor transplantation as the best treatment choice. We have special programs that can help patients obtain a living donor. They do not have to be the same blood type. If you have a potential donor that is not the same blood type, we can enter an exchange program. We can enter a registry when you can give, your donor can give on behalf of you to another recipient, and that recipient's donor can give a kidney to you, and thus solving the problem with the blood type. So that is an unique program that we participate in. We probably have one of the largest participations in the country. A patient receiving a kidney transplant allows them to be close to a normal person. They will live longer and better. They will have close to a routine that a normal person would have that has any medical condition. It is, compared to dialysis, less time consuming. Dialysis can be hard on the body and it takes a long time. With transplantation, patients need to take medications, they need to see doctors once they are stable, about 3 to 4 times a year. That allows them to do more things with their life, allows them to travel, to stay healthier, to be more present for their families. Unfortunately, the wait for a kidney transplant from a donor from the list, a cadaveric donor, can be a long time. There are many factors that go into it. The primary driving force is blood type. But if you have a living donor, there is no wait time. And this is why it's important to really enforce that, to really think about that. We don't think about living donation from kidney as part of our daily thing, like we think about other things like blood donation. So we're trying to get the message out. People need to talk about this and tell their stories. And it is true, people do not realize that there are kidney donors needed. If you go to wait on the list, the wait time could be 7 years of more or more for a certain blood type that usually waits the longest. To get a living kidney donor, we need to tell our story. We need to say, we have kidney disease. We need to get the message out there that kidneys are not readily available, that we need our friends or family to help. To get a living kidney donor, we have resources at MedStar Georgetown Transplant Institute that can help donors get the message out, such as the ability to create a microsite where you can share with your friends on your social media, tell your story of why you have kidney disease, that your doctor has said that that is the best treatment option. I think that is what gets you the furthest. And in my experience, we've seen a lot of people being successful that way. So when a patient gets a kidney transplant, they're going to look towards the future for a long life as compared to dialysis. Dialysis, it's hard on the body and it causes a lot of problems. And patients start having complications very early on. With a kidney transplant, at 5 years, over 95% of people are alive, especially if you get a living donor. Living donors, recipients live longer. So it is a life, a very fruitful life. where you are close to what the general population is, um, that does not have kidney disease or have a transplant. Patients that receive kidney transplant can have the transplant for a long time. All you have to do is take your medications every day, listen to your doctors, listen to the advice of your team, come to your appointment. It really is something you can do. And when compared to being on dialysis or treating other diseases such as diabetes of high blood pressure, it's very similar to just going to your doctors for your regular checkups, usually after the first year, every 3 to 4 months. So the medications are essential, but it is doable and they become simpler over time. I think in the beginning, it may seem like patients have to take a lot of medications for a kidney transplant, but over time, the medications become a lot simpler. Is most of the patients usually don't take a lot of medications compared to the medications that they were taking before. A lot of the conditions tend to improve, and there may be less medications for high blood pressure and less medications overall. I think it's a very good trade-off considering the amount of time and medications that are necessary when you are on dialysis. I offer services to Spanish-speaking patients. There is a large population of Spanish-speaking patients that come to MedStar Georgetown Transplant Institute. We have now a team that includes myself and other level of staff to make their care more personal, to make them more comfortable. It is important to see a familiar face when you come to your medical care. End-stage kidney disease and kidney transplantations are stressful conditions. It is hard to go through the process of evaluation and continue to care for a kidney transplant. So when you have a familiar team that shares uh, some of the background and culture and speaks the same language, it is better. And that's one of the reasons that I joined MedStar Georgetown Transplant Institute, to provide that service to those patients that really need it. Nosotros ofrecemos una clínica en español. Yo soy una doctora que viene de un país latino y me gusta darle a los pacientes la opción de ver a alguien más familiar, alguien que pueda ser más personal, que pueda hablar el mismo idioma. Este servicio es particularmente ofrecido por mí, y tenemos también otros asistentes que hablan español.